No one knows what causes ulcerative colitis or UC, but it can happen at any age, and the number of patients with UC is increasing. It's important to know that you can work with your healthcare team to manage UC and live the life you want to live. But you might be frustrated. The drug you've been taking for months for your UC seems to have stopped working, and you're having another flare. Maybe you should just wait it out. Settle for feeling okay rather than great. It worked well enough the first time, so maybe it'll work again. And besides, it just seems like switching will be so much trouble. Stop. You deserve to feel good, not just okay. This is not an easy disease to live with, and there aren't many conditions that touch nearly every aspect of your life like UC. There are the foods you've learned to avoid because they make you feel worse. Making sure you're always within sight of a bathroom. Missing school or work when you have a flare. Everyone tells you to reduce your stress. But how can you do that when you never know from day to day how you're going to feel? As for planning ahead, whether a walk with a friend, dinner out, or a vacation, forget about it. You deserve the chance to live a normal life. Listen, you're not alone in having to switch medications. More than half of those with UC find their treatment stops working within the first 6 months. Thankfully, there are lots of other choices out there. These include 3 biologic classes of drugs, a newer oral small molecule therapy, mesalamines, and combinations of these drugs with immunomodulators that can help put you in remission and, fingers crossed, keep you there. One of the first things your healthcare provider should consider if you're having a flare is to rule out an infection. Then consider checking your drug levels. If these are too low, they can help you adjust your therapy by increasing the dose or how often you take it. Otherwise, it's time to look at other options. It's possible to have no symptoms of UC but still have active disease. That's why the goal of therapy these days is to treat to target. This approach involves changing your treatment to heal the lining of your intestine. This is called mucosal healing. This might include changing doses or adding medications so that you're taking a combination of therapies or switching treatments altogether until you reach remission. Remember, healing on the inside of your intestine is just as important as feeling well on the outside and not having any symptoms. Not all healthcare providers know about this approach, so don't be afraid to bring it up yourself. Any discussion should start with what's important to you when it comes to your life. After all, while your healthcare provider may be the expert on your disease, you are the expert on yourself. The best way to describe this is that your provider should talk with you, not at you. Remember, it's important to always ask questions. How well does this drug work? How does it work? What are the side effects? How do I take it? How soon will it start working? How will I know if it's working? Will my insurance cover the cost? What if I miss a dose? How will it make me feel? What are the short and long-term benefits? The side effect discussion is critical. Every drug, even aspirin, has risks. The question is whether the risks of side effects outweigh the benefits of the drug for you. Because while the FDA only approves drugs if the overall benefits outweigh the risks, the agency doesn't know what the risks and benefits are for you, as they may be unique to you, your health history, and biology. That's something only you and your healthcare provider can decide. For instance, if the medication can delay or help prevent surgery, the risks may be worth it. Also, consider how the drug will affect your lifestyle. For instance, maybe you've been on a medication you could inject, and now your healthcare provider recommends one that requires an IV infusion. You may have to go to a clinic to have it done, or have the infusion performed at home. Are you okay with that? What if the drug increases your risk of an infection? Would you rather take an oral medication that isn't injected or infused? Once you and your healthcare provider decide on the best therapy, there's another step: taking it. Believe it or not, between 40 and 72% of people with UC don't take their medication or receive their infusions. Sometimes the reason is cost, sometimes side effects. Sometimes it's simply life getting in the way. And sometimes it's because there wasn't enough education provided on why it's so important to take a medication. So you should reach out to your doctor, your nurse, or your pharmacist. They're there to help. Having trouble getting to the clinic for your infusion? Home health might be an option, but ask your health insurer. Is cost an issue? There are numerous organizations, including patient savings programs, that can help. Your provider can help with these resources so you don't miss a dose. And if side effects are a problem, maybe a lower dose is a possibility. If you're a man, you might be worried about the effects of medications on your fertility. If you've had pelvic surgery, you might be worried about erectile dysfunction. Again, your healthcare provider can help you make these important decisions and connect you with sexual health specialists who are trained to treat these conditions. If you're a woman, do not assume that you can't have a baby. Talk to your provider about this common misconception. If you're thinking about getting pregnant, you might be worried about other things. Will I be able to get pregnant? Will the baby be healthy? Will my UC stay in remission? Will I be able to breastfeed? For most patients, the short answer is yes. You can have a healthy baby and breastfeed too. Studies find that if you're in remission and haven't had pelvic surgery, you're just as likely to get pregnant as women without UC. If you have had surgery, you may be able to get pregnant, but your ability to give birth may be affected. Talk to your healthcare provider because treatment options such as in vitro fertilization exist. Remember, everyone is uniquely different. Once you're pregnant, you may have a higher risk of surgical complications at the time of delivery. If you are at risk, it may be a good idea to find an obstetrician who specializes in high-risk pregnancies or see a colorectal surgeon. However, keeping the disease itself in remission may reduce those risks. The good news is that if you get pregnant while in remission, you're more likely to stay there throughout your pregnancy. You might also be worried about taking medications while pregnant. Don't worry, you can relax. Most medications for UC are safe during pregnancy and breastfeeding, with a few exceptions. Again, talk to your healthcare provider and other specialists. The bottom line is that while UC isn't curable yet, it is manageable. Together, you and your healthcare team can work to select the best drug for you. You deserve to do the activities you enjoy, live the life you want, and cross the milestones you desire.